I'm Drew Williams, and I'm a physical therapist with the Everett Clinic. I grew up mostly on the East Coast and some overseas. So I lived in Kenya for several years growing up, spent 5 years there, and then lived in Columbia, South Carolina for most of my childhood, so college and high school. So I went to undergraduate at the University of South Carolina and did exercise science there, and then ended up going into what's called the U.S. Army Baylor program. So it's a joint program with the Army, and but it's down in the San Antonio area. And so I spent a time down doing my schooling down there, and then was in the Army after that as an active duty physical therapist. So I spent several years doing that after I graduated. Well, I think the Everett Clinic in particular drew me just partially because they work together well as a team. I think there's the opportunity to see all the notes from what the doctor's written. You can see all the imaging, all the pictures from the patient that makes it real clear and simple to pull together. They allow you to spend a lot of time with the patient. There's a lot of clinics out there these days that really try to push a lot of the work off onto aides or other individuals who may not have the same education. And in this particular setting, we're allowed to see the patient for a lot longer ourselves and do all of the implementation of that program, which I think there's a lot of pluses to that for both for us and for the patient, because then we know more about what's going on with them. We can kind of see how they're responding, and then we can tailor it to their particular needs. I think the most rewarding thing about my day-to-day job is when you see someone who has maybe been incapacitated from something for years, and maybe they've been bounced around from place to place, and they've done this and they've done that, and they really found nothing that works for them, and they've tried maybe things like medications, they've tried injections, and then they haven't gotten to where they want to be. And then sometimes it's as simple as teaching them a new skill and a new movement pattern, and you can actually get that person to where, in a few months they're really doing things that they haven't done or haven't thought they could do in years. And just to see their excitement and the way that they respond to that is really cool.